Good day, everyone. Today I'll be talking about a very common and often misunderstood condition, sciatica. This isn't just about back pain, it's about what happens when that pain travels, sometimes all the way down to your toes. So let's break down what's happening, why it happens, and what warning signs you should never ignore. Where before we dive too deep, we need to know what is sciatica. We will also discuss the structure of the spine, disc labeled medical names, and its positions. In addition, we will explore the potential complications and risks associated with sciatica, including both common symptoms and more serious neurological concerns. To conclude, we will present 5 effective, easy to perform stretching exercises designed to relieve discomfort associated with early stage sciatica, which can be practiced at home or in virtually any environment. So stay with us and watch the video to the end. Now, before we dive too deep, we need to know what is sciatica. Sciatica refers to pain that radiates along the path of the sciatic nerve, which branches from your lower back through your hips and buttocks and down each leg. It typically affects only one side of your body. Now, it's important to note sciatica itself is not a condition, but rather a symptom of an underlying issue. The structure of the spine. To understand why sciatic nerve pain happens, let's look at the spine. Your spine is made up of vertebrae, bones stacked on top of each other, with intervertebral discs in between. These discs act as shock absorbers. Each disc is labeled based on its position: C1, C7, cervical spine, neck; T1, T12, thoracic spine, mid-back; L1, L5, lumbar spine, lower back; S1, S5, sacrum, coccyx, tailbone. The most commonly affected discs in sciatica are L4, L5, and L5, S1, the lower lumbar and top of the sacral spine, which is called lower back or mid-back in simple words. Sciatica causes back pain, shooting pain down the leg, numbness or tingling, muscle weakness, burning or sharp sensations. In some cases, the pain can travel all the way to the toes. What causes sciatica? When a disc herniates or degenerates, the inner gel-like material can press against the spinal nerves. Some physical activities that can cause or worsen sciatica are heavy lifting with improper technique, for example, bending at the waist instead of knees; repetitive twisting motions, common in sports like golf or tennis; high-impact sports, for example, running on hard surfaces or jumping; prolonged sitting or driving, especially without lumbar support; intense lower back workouts without proper warm-up or stretching; poor posture during exercise or daily activities. And in some cases, the causes that contribute to sciatica may also include obesity or trauma to the spine, poor posture, or even aging. Potential risks of sciatica. Understanding the potential complications associated with sciatica, particularly when it is left untreated or becomes chronic, is essential. The risks vary in severity from moderate to high, and this infographic outlines the key categories of concern. It includes descriptions, severity levels, and the likelihood of each risk manifesting if left unmanaged. We begin with the most frequently encountered issue: chronic pain. This refers to persistent pain radiating down the leg, which can substantially hinder everyday activities and significantly diminish quality of life. The severity level is considered high, and if left untreated, the likelihood of occurrence is assessed as very likely. Next, we address nerve damage. This occurs when prolonged pressure on the sciatic nerve results in permanent injury, potentially causing lasting numbness or muscle weakness. The severity is also categorized as high, with a likely chance of developing if not addressed promptly. Following that is mobility impairment. This condition may lead to reduced leg function, muscle weakness, or difficulty walking, often due to nerve dysfunction or pain-related physical avoidance. The severity ranges from moderate to high, and the probability of developing this condition is considered possible if untreated. Another serious concern is bladder bowel dysfunction. In severe scenarios involving cauda equina syndrome, individuals may experience a loss of control over bladder or bowel functions. This may present as an inability to sense the need to use the bathroom or a lack of control altogether. It is regarded as a medical emergency with a critical severity level and a rare but serious likelihood of occurrence. We then consider sleep disturbances. Sciatica-related pain may intensify during the night, disrupting sleep patterns and leading to fatigue, increased stress, and even mental health decline. The severity is classified as moderate, with a likely chance of affecting untreated individuals. Mental health issues also represent a potential risk. Chronic sciatic pain can contribute to psychological conditions such as depression, anxiety, and a reduced sense of well-being, largely due to decreased physical activity and independence. The severity of this issue is considered mild to moderate, and its likelihood is possible if left unmanaged. Lastly, we look at dependency on pain medication. Prolonged reliance on either over-the-counter or prescription medications can result in tolerance, adverse side effects, or even addiction, especially in chronic cases. This issue carries a moderate severity level and a possible likelihood of occurrence. Having explored these potential risks, it's also important to consider preventive measures. Engaging in simple, gentle exercises at home or in any comfortable space can help relieve sciatic discomfort, especially if symptoms are mild or you're aiming to maintain flexibility and prevent the onset of sciatic nerve pain. Here are 5 simple stretches for sciatica relief that are quick daily moves to ease that pinched nerve pain. Now, before we dive into illustrations, I would like you to pay attention and keep in mind that these stretches are for general informational purposes only and are not a substitute for professional medical advice, diagnosis, or treatment. Always consult with your doctor or a licensed healthcare provider before starting any new exercise, especially if you have severe symptoms or underlying health conditions. The creators of this content are not liable for any injury or complications that may arise from its use. So as the first flexibility move, you can start with the stretch #1, knee to chest, as illustrated in the picture. The steps are to lie on your back, gently pull one knee to your chest, hold for 20-30 seconds, switch legs. This stretching exercise helps release pressure on the lower spine. We named stretch number 2 as piriformis stretch. So in order to perform this, you need to follow these steps. Lie on your back, cross your right ankle over your left knee, pull your left leg in to feel a deep glute stretch. And of course, this move is a great move for easing sciatica-related tension. This was the second stretching practice out of 5, and the third stretching exercise is seated spinal twist. To simplify this stretch, we divide it into 2 easy steps. 1, sit upright, cross one leg over the other. 2, twist gently toward the top leg. This stretch opens up the lower back and eases nerve pressure. Stretch #4, cat-cow pose. The steps are to make a pose as illustrated in the pictures on hands and knees. Arch your back up, cat, then drop your belly and lift your head, cow. Repeat 10 times for spinal mobility. It's worth mentioning that the cat-cow pose is a gentle flowing stretch that helps improve spinal flexibility and relieve tension in the lower back, making it especially useful for sciatic pain relief. It involves arching the back, cat, and then dipping it, cow, while on hands and knees. This movement warms up the spine, loosens tight muscles, and encourages better posture. The tip to make this pose more useful is to breathe deeply, inhale as you arch, cow, exhale as you round, cat, and move slowly to get the most benefit from each motion. Stretch #5, child's pose. To perform this pose, you will kneel and sit back on your heels, arms stretched forward. Breathe deeply and hold for 30 seconds. This pose lengthens and relaxes the spine. So thank you for watching the video. These were 5 simple yet effective stretches to help relieve sciatic pain. We hope you found them helpful. If you did, feel free to share your thoughts in the comments, and don't forget to like and subscribe for more health and wellness content.